Hey, this is Dr. C. Hope you're having a good day today. I'm having a better day. Yes, a better day. I had COVID over the holidays and man, it knocked me for a loop. So I'm back, I'm negative, and I'm here. So today we're going to talk about number one. Oh, what the heck? Who are you going to talk about yourself? What's going on? No, back when I was a kid, number one referred to P. Couldn't use those four-letter words back then. Very puritanical back then, you know. No four-letter words, number one. Why? Why was P number one? I don't know. Nobody really knows. But nevertheless, we're going to talk about some of the problems the elderly can contract with their P. And I'm talking about a significant number of elderly. So the three major areas I'm going to talk about with regard to the P, number one, infections, which are very common. Number two, blood in the urine, hematuria. And number three, incontinence, losing your P. Those three things. So let's get started. First of all, let's talk about infection, okay? Our kidneys see roughly about 160, 180 quarts of blood every day going through it. Produces over a quart of urine every day. It does it by filtering the urine, taking out all of the bad stuff out of it, the toxins, the byproducts of metabolism in your body, all these bad things they take out. So that's number one, a good filter. And then there's a reabsorption going on at the same time. So that adjusts the electrolytes, sodium, potassium, that type of stuff. And then it does release hormones as well, because they can sense, the kidneys can sense when there isn't enough or there's too much blood volume. So all these things are going on all the time in those kidneys. They can get infected. Usually the infections come from below. They come up the urethra. That's why the women who have a shorter urethra have many more urinary tract infections than men do. So, what are the things that you look for as a sign of infection? Well, could be pain. Could be you're peeing too often now, even during the day, and you're getting up 3-4 times at night, and it burns. All these things are symptoms of an infection. How can we diagnose an infection in someone? Well, I brought with me my little dipsticks. You've heard that term dipstick. I hope nobody called you a dipstick, because that refers to stupidity, a dipstick. That's what the term is turned into now, a dipstick. Gee. Well, that little dipstick is what I used to use exclusively, really, over at the medical clinic at St. Anne's that I had. And I would dip that stick into a cup of urine, and it had to be a clean catch urine. In other words, midstream, dip it in, and we can tell. Now, how can we tell? Well, there are several things that the dipsticks look for. Number one, looks for infection. It looks at the products that the white blood cells that are basically there for the infection, to kill the infection, those white blood cells give off leukocyte esterase, and I can measure that. Positive, 1+, 2+, 3+, depending on how severe the infection is. It also will test for nitrites. Now, nitrates are generally in the urine. They come from amino acids that we metabolize in our body. And this will, the bacteria convert it to nitrite. So if I pick up nitrite, Positive 1, positive 2, another sign of infection. So if those two things are positive, there's probably a good 75-80% chance patient has a urinary infection. Of course, that is together with the history that you get. Okay? What else does it look for? It looks for protein in the urine. Shouldn't be any protein in the urine. Shouldn't be. Because proteins are bigger molecules. They don't get through. They're not filtered. And so if you pick up protein in the urine, that's not a good thing. It also tests for the pH. Is it too acid? Is it too alkaline? Usually our P is just slightly on the acidic side. So that looks for that as well. It looks for the presence of blood, red blood cells. And again, it gauges it as mild, moderate, severe, gross, that type of stuff. Red blood cells. And so what it does with the red blood cells, it looks at benzidine. That's what the little strip has, benzidine. And in the presence of red blood cells, it will change colors. So that's what it looks for. It also looks for ketones. Ketones would be a sign of you're not eating enough. You're burning a little bit too many calories. You're starting to burn maybe some of those muscle calories. You're not eating enough. Ketones will tell you that. And finally, it'll give you your glucose, the sugar. So normally we spill a little bit of sugar and shouldn't be spilling a lot of sugar in the urine. So those are the things that we look for with a dipstick. Okay, so we're talking about infection now. What are the major causes of infection? Well, I told you first that women tend to get more infections than men. So what are the causes of women getting infections? Well, the major cause is simply hygiene. Hygiene. You got to learn how to clean yourself properly. Women should wipe themselves after every urination, after every bowel movement, wipe from front to back. Very simple, very simple. Believe it or not, there are some who don't even wipe. Believe it or, well, I'm sure you believe that, but they're, so hygiene is number one. Number two, you got to go regularly. Don't hold it all the time. Holding it is not a good thing. Of course, if you're out in public, you got to hold it for a while, but nevertheless, you got to establish a routine to empty the bladder regularly. That's number two. Now in men, their prostate about age 40 starts to enlarge. It enlarges from the inside out. So it's like a horse chestnut. You've all experienced horse chestnuts. It has a big thick coating to it and then a horse chestnut in the middle. And so that horse chestnut gets a little larger after age 40, grows, squeezes the natural prostate tissue out to the edges of that so that it's like the size of, probably a plum on both sides now. And a little, I guess you might call it a wedge in the middle. Okay, so that's the prostate gland. That enlarges and it can slowly narrow down the opening from the bladder to the outside. That is the primary cause of problems, urinary infection problems in men. Okay, so those are some of the reasons. Also now in older women, postmenopausal women now, the lining of the vagina thins out. It thins. It gets dry. And so a lot of times the women will use douches and various preparations that they get from the drugstore and all, none of which really are that satisfying as far as medical treatment of that thinning. Really, the only thing that seems to be effective is the use of a hormonal cream. Hormonal cream will help. It will. But you don't want to overuse it, that's all. So that is also one of the reasons. Now also, believe it or not, those of us in our 70s and 80s and 90s, they still have sex. Sex is another big component to infections in women especially. And so you pee before and you should pee immediately after sex. Very simple. Well, not so simple, but that's basically what I wanted to say. Now, people who have dementia may not even realize that they have to go and pee. They don't realize. They just wet themselves. Not a good thing. So a lot of people with dementia have urinary tract infections as a result of simply not recognizing the fact that they have to go. So those are the major causes of infection. Most of the bacterial infections are caused by a bacteria known as E. coli. Roughly 75-80% of them are from E. coli. Now, diabetics can get them for a variety of bacteria. Diabetics have a very weak immune system, and so they are very prone to urinary tract infections, as a matter of fact. So, but most of them in the routine, especially the non-diabetics, are E. coli. How do we treat these urinary infections? Well, you treat them as simply as possible. You can, as a simple thing, drinking a lot of liquids, especially a lot of water. Drink a lot of water. What are some of the things that you need to do? Well, you need to think about other things. For example, cranberry juice. Now, cranberry juice has a component, a little chemical in it, that will allow attachment to the wall of the bladder. And that helps to prevent the bacteria from causing symptoms in the bladder. So even though cranberry juice isn't a great treatment for infection, it does seem to help to prevent infections. So, but you have to drink a fair amount. So it's a plus minus, I guess, a plus minus. So what are the other things that we use? Generally, if you have to be put onto an antibiotic, we generally will use things like Bactrim or Septra, which are basically sulfur-based antibiotics. Also, Macrobid. Macrobid is a very good antibiotic, and it's probably the one I used mostly towards the end of my practice and all. I gave out more Macrobid than I did Septra. But still, both of them were about equal in the number of treatments that I gave out. We can also use other things, but you got to watch out. There are side effects from some of the heavy antibiotics, like the floxins, the ciprofloxacin, for example, Cipro. Over the course of time, it weakens ligaments. So people who have been placed on Cipro for usually a little lengthier treatment than normal tend to have weaker tendons. They can suddenly rupture their Achilles tendon. They can rupture tendons in their hands and their feet. And so we tend to watch out giving a lot of that broad spectrum heavy antibiotic to people with urinary infections. Okay. Now, the infections don't necessarily have to be in the bladder. Of course, that's the most common, in the bladder. The infection can go up the ureter, up into the kidneys as well. Pyelonephritis. Now, that can be a serious infection. Sometimes you need to have IV antibiotics to really knock that out. Again, diabetics are very prone to get things like pyelonephritis. So be aware that if you start getting flank pain, fever, chills, you had better think about getting that urine checked right away, especially if you're diabetic. Okay. So there are other things that that can be done, but I think we covered probably the most important of all of them. The latest treatment is using a thing called D-mannose, dextromannose. Now, you can buy dextromannose out on the counter, over the counter, and it's under the trade name, I think, of D-manna. And that also, just like cranberry juice, will help to prevent the attachment of bacteria to the wall of the bladder. So that is one of the latest of the treatments. Let's talk about blood in the urine. Okay, hematuria. There's many different categories of hematuria. You can have hematuria in a young person, hematuria in the elderly. Hematuria could be microhematuria. You don't see it, but you see it when you spin the urine down or you get a positive dipstick. Or gross hematuria. Now, it doesn't take a lot of blood to get gross hematuria. 1 ml, 1/5, excuse me, 1/5 of a teaspoon of blood will cause a quart of water to have a haze in it. Doesn't take much blood. So remember that. So there's microscopic, you don't see it, and gross hematuria. You can see it in the blood. There's also a difference between male and female as well. So all these different things, and pain with the blood and painless with the blood. So all these different categories with blood in the urine. Now, you can get mild blood in the urine with many, many different different reasons that don't require treatment. For example, exercising with a lot of intensity for a longer period of time. After a football game, after a hockey game, where there's a lot of contact, you may actually get a bout of microscopic hematuria. And so that will pass in a day or two. So you don't necessarily have to do anything except drink plenty of water. That's it, basically. The elderly who take aspirin, for example, for heart, roughly a quarter of them will have microscopic hematuria as a result of the thinning of the blood with the aspirin. Yeah, a quarter. That's a lot of people, really, you know. So what do we do to work it up? Well, if it's microscopic hematuria, we want to be sure that we know what's causing it, obviously. And it's obviously the same with gross hematuria as well, because gross hematuria is just as bad as microscopic hematuria. If you go to a urologist, they'll probably want to do a look-see inside, cystoscopy. They want to do an ultrasound of the urinary system and see what they can see. If you're a smoker, bang, you got to stop smoking. That's right away, right away. Roughly about 10% of people who have the hematuria will wind up having a cancer, a growth, either in the bladder or in the kidney as a cause for their hematuria. So even though it's not a high number, it's still always in the back of your mind, do I have a cancer? So, okay. What else? Well, that prostate in men, that can cause bouts of hematuria because as that central core, remember I said it pushes the prostate, as the core grows in the inside, pushes the prostate tissue, and the veins on the top of it get very distended, dilated. It slows the blood flow down. They can rupture the little blood vessels and blood in the urine. Okay. I should mention, too, a very quick one, you can get hemospermia, blood in the ejaculate in the men. That's not a problem, not a big issue at all. A little rupture of a blood vessel in the area of the prostate and all, that clears in a day or two. Don't worry about it. That's an easy one. So So you've gone to the urologist. They are going to do a look-see, first of all, at that urine. Are there crystals in the urine? I remember when I was doing this stuff, looking at urine in under the microscope, I'd look for uric acid crystals, calcium crystals. Could tell me if there's a stone. Could be a stone that's causing blood in the urine. Usually with a stone, there's pain. When that stone moves, it is painful, very painful. So, but you look for crystals because that can give you an idea, at least, of what the cause may be. Okay, very good. And also when you're looking at that urine again, we look at what the red blood cells look like. Do they look all beat up? Because they've passed through that filter system in the kidney. They shouldn't, but if they do make it, they look beat up. They look ragged under the microscope. Dysmorphic red blood cells. That's a clue you may have glomerular problem in that kidney. Okay. I think we've gone through that enough. We won't go into the treatment because there's so many treatments depending on the cause. Let's talk about incontinence now. There's various types of incontinence. First of all, you can have stress incontinence. Whenever you cough, sneeze, laugh, sudden urge, sudden strain, you squirt a little urine out. That's much more common in women than in men. Could be because of pelvic relaxation from having children, etc. Could be from overweight, stretching it out. So nevertheless, the pelvic muscle down there has stretched, and so it's weak, and when you cough or sneeze, boop, out comes a little bit of that number one, the pee. That's a stress incontinence. You could have overflow incontinence. This is more common again in men than women because the prostate has now narrowed things down so that the bladder now is much larger capacity than it was before. Normally when you get about a fifth of a quart, about 200 cc's, fifth of a quart of urine, you get an urge to pee. Normal. But now it's been stretched and stretched and stretched. Now maybe 500-600 cc's, half of a quart before you get that urge. That's overflow incontinence. You pee it out, but you never empty. You can't because there's not enough strength in that bladder, which has been stretched out, to squeeze that urine out. So that is another form, overflow incontinence, overflow. What's another one? Another one is reflex incontinence. Now that reflex incontinence is usually due to some type of spinal disease, like ALS, for example. Anything that demyelinates those nerve fibers can cause that type of reflex incontinence. It could be due to medications. Like say you take a diuretic. Diuretic works, you gotta pee. So diuretic can actually cause some incontinence as well. Antihistamines can cause it. Tricyclic antidepressants can cause it. Now, we used a lot of antidepressants, the tricyclics, back when I was in practice. Now, they use much different ones. Not necessarily better, but different ones than the tricyclics, which had a lot of side effects as well. Calcium channel blockers, we use that for blood pressure control. That can cause some problems with incontinence as well. Alpha blockers. What's an alpha blocker? Well, like the Viagra that you use, the vitamin V. That is an alpha blocker, and that can also cause incontinence. So those are all the different types of incontinence. The last one is urge incontinence. Now that's the one that a lot of the drug companies now are promoting. A lot of the medications take away the urge. quiet down that muscle in the bladder. Well, do they all work? No. Maybe about 50% success, but I guess 50% improved. Is the glass half full or half, whatever. 50% improvement, I guess some people would take it. What can you do outside of getting a medication for it? Well, number one, Kegel exercises. Now, Kegel exercises have been prescribed for women for years, and they have to be done properly. What do I mean by that? First, you empty your bladder. Empty it. Then, sitting down or lying down. Then, squeeze like you want to close off the urine, close off the bowel. Hold it for a count of 10, and then relax for 10. And then close it again, and then relax. You hold each one for 10 seconds, and you do 10 of them 3 times a day. That's the proper Kegel exercise. Now, yeah, it's still occurring, so you got to get pads. What kind of pads do you get? Well, there are pads, and then I guess there are diapers. Yeah, diapers. What do you look for? Well, first of all, depends on what type of incontinence you have. If you just have the stress incontinence, when you cough, sneeze, whatever, you don't need a big absorbent pad. So you get the lighter one. Now, if you're a little more, maybe a fair volume during the daytime as well, you may need something with moderate absorption. Now, if you tend to overflow at night, fair amount, you need the big nighttime absorbent pad. So the absorbent pads at night are different. They have much better improved sides. Most of the absorbing stuff is in the middle and away from the skin so that it's not wet, it's not moist, it's not irritating the skin all the time. Plus, around the upper thighs, it's nice and snug so you're not leaking out onto your bed. And there's good odor control in them as well. Nowadays, you also can get eco-friendly type pads. Like, for example, a lot of the Attends, Depends, Poise, Tima, all these have good odor protection as well. So, I think I've overridden my time. Those are the 3 things I wanted to talk about for number 1. This is Dr. C. Have a nice day.